My first guest is Dr. Jason Harrod, a foot and ankle specialist with Bluegrass Orthopedics. Welcome.
Thank you.
So, foot and ankle, feet when they hurt, that affects everything. So what are some common causes? What are some things you see that cause foot pain?
Plantar fasciitis is a common one. Heel pain, Achilles tendonitis or pain on the back of the heel or the lower leg, the large tendon on the back of the leg, bunion deformities, neuromas, and often fracture, trauma care.
Well, you started with Achilles tendonitis and heel pain, plantar fasciitis. What causes that?
Typically overuse, poor biomechanics, poor shoe gear, trying to get into an activity a little too quickly without properly ramping up, a little too much too fast.
What do you do about it?
So, specific plantar fasciitis requires a period of immobilization, often, depending on how long it has been going on. It can be both an acute and a chronic situation, so depending on the particular presentation of a patient. If it's more acute, we'll investigate that and make sure there's not more of a tear if this maybe happened in a runner. If it's more the typical plantar fasciitis, heel pain, the first few steps out of bed in the morning are usually pretty rough. Yeah. And as we get up and move around, maybe it lets up a little bit, a false sense of security, we have a seat, maybe have lunch, and then we get up again and we have that continued heel pain right on the bottom of the heel, and it's gnawing, often described as a spike going into the bottom of the foot. So oftentimes we'll take an x-ray and we have to kind of dissolve the myth of spurring on the bottom of the heels because that can kind of feel like a stabbing pain. But it's really an inflammatory process of a ligament or an aponeurosis on the bottom of the heel. And so we will consider a period of immobilization or activity modification, anti-inflammatory medication, stretching and icing, sometimes physical therapy, architectural support with either an over-the-counter insert, maybe an orthotic. And as we go further down the line, sometimes we'll need to get some advanced imaging with an MRI to indicate if there is maybe a tear. Sometimes we'll consider a corticosteroid injection. And if it goes on long enough and is recalcitrant or doesn't respond to conservative care, sometimes it's a surgical problem.
Okay. You also mentioned bunion. Mm-hmm. What is a bunion? Is it just cosmetic or does it really mean something?
Well, it really means something. A bunion deformity is a developmental problem, usually related to the biomechanics, again, of the foot. A lot of times this will run in family, so we'll often ask about mother, sister, aunts, mostly on the female side, but can be on the male side. Nonetheless, it's a developmental problem where there's a knot, essentially, behind the big toe that is quite painful and really affects activity. Oftentimes folks will have to get a wider shoe to accommodate that deformity, but it's not something that we have to just deal with or just accept. That can be addressed from a surgical perspective.
Just shave it off, realign the toe?
Good question. Years ago, yes, we thought that's how we did it. But research, lots of research in the foot and ankle world has indicated that it really requires a realignment. This is more of a malalignment or a movement of a couple of bones in the foot that have gone to a bad position. So we perform what are called osteotomies or bone cuts to realign the bones that need to be realigned, and we will often use hardware to maintain that alignment. And the success rates are anywhere between 85 and 90%, with some other factors that play into that. But overall, it works.
Okay. Now you also mentioned Morton's neuroma. Most people don't have any idea what that is.
So a Morton's neuroma, often called a pinched nerve, is an inflamed or aggravated nerve in the foot, thought to be related to, again, biomechanics, we go back to that, or overuse. We see that oftentimes in runners. It is an irritated nerve that is a burning, lancinating type of pain that we often treat with a steroid injection, and many times that can be successful and settle that down. Sometimes we have to go a little further with some alternative type injections, some sclerosing injections to chemically destabilize or kill that nerve essentially, and then ultimately surgical excision if it were to be an ongoing problem.
Well, all that's great information. So if you've got foot pain, there's a lot of causes for foot pain. Dr. Jason Harrod with Bluegrass Orthopedics can help.